Hi everybody, this is Dr. Firdaus. My goal is for you to become 1% better today after learning everything there is to know about dental cavities and how to develop better habits to avoid them. I will share with you how bacteria damage our teeth and offer preventive measures. While science supports everything I will discuss, the video is not an academic research. It's a learning video designed to help you create and change your habits in a way that is easy to understand and apply. Although I am a dentist by profession, I am not your dentist. This video's content and material are solely intended for educational and informational purposes. Seek professional help for expert guidance on meeting your needs and addressing your situation. The video's content focuses on healthy individuals and excludes several factors such as genetic disorders, medical conditions, and dietary restrictions. It is in my best interest to guide you in saving your teeth, though some of the statements may be controversial. As you may have heard, enamel is the strongest substance in our body, composed of minerals that are tightly packed together in a crystalline structure to form a tough shield to protect our teeth. This illustration shows how atoms are arranged to create enamel. Despite its strength, enamel can be damaged over time by bacterial waste. This is known as dental cavities or tooth decay. Billions of bacteria coexist in our mouth at any given moment. Some of these bacteria are helpful, such as those that aid in food digestion, while others are dangerous and can cause cavities. Each person has a different population of oral bacteria, mostly due to diet and dental hygiene. Let's say your teeth have been professionally cleaned by a hygienist, and your teeth have clean surfaces. Bacteria in your mouth will soon begin to stick to your teeth. That is not an issue. Remember that there are both beneficial and harmful germs. The issue arises when harmful bacteria colonies are allowed to grow out of control and deposit their acidic waste into your teeth, which leads to cavities. What makes harmful bacteria grow more than beneficial ones is the diet we consume. Food and drinks contain both sugar and acidic ingredients. Bacteria eat that sugar that we consume and excrete acid as a waste, and that breaks down the crystal structures of the enamel. Acid can also be produced by ourselves through vomiting and acid reflux. These are the routes that it takes to harm our teeth, but sugar won't be a problem if we are more careful to brush before and after bed and floss after meals, because the germs won't have an opportunity to harm the teeth. The following are the stages from having healthy teeth to developing an abscess. Over time, it becomes damaged as a result of bacteria forming communities in the form of plaque and releasing acid. Initially visible as white spots, this condition is known as incipient lesion. If left untreated, it gets darker and deeper inside the teeth. In a cross-section of the tooth, we can observe an enamel cavity, which is an early stage of the cavity that is represented above as a white or light brown spots. Only at this time can the cavity be reversed without fillings. Cavities can take years to form, but if they get into dentin, the second layer of the tooth, they grow faster and can cause discomfort. If left untreated, it can reach the nerves of the tooth and cause unbearable pain, something I personally experienced. It can further spread down the root and as a result cause abscess with possible swelling. The longer you wait untreated, the worse it gets and the more costly it is to restore it. Let's look at exactly that happens on the graph, which is referred to as a Stephan's curve. After 10 minutes of eating food, as shown by a donut, our mouth gets more acidic because bacteria digest sugar and release acid. The pH below 5.5 is known as the critical pH at which enamel damage begins. Our saliva protects our teeth by neutralizing the acidic environment in about 30 minutes, allowing us to stay above our critical pH, which is less acidic and more neutral. Typically, our mouth pH is somewhere around 7, which is the neutral pH, and the goal is to stay in the green zone above critical pH for our enamel to get restored. Now let's understand what circumstances damage our teeth and what we can do to improve it. Cavities are more common in those with dry mouth because their teeth are exposed to acidic environments for longer periods of time due to inadequate saliva. For this reason, it is beneficial to chew on xylitol gums after meals to promote salivation. Keep in mind that more saliva means quicker recovery to neutral pH and less chance for teeth damage. Interestingly, xylitol-specific gums work by tricking bacteria into thinking it's a sugar. As a result, when the bacteria consume it, their bodies are unable to break it down and won't produce acid to damage our enamel. Our saliva shields our teeth by supplying calcium and fluoride, which are needed to rebuild the enamel. We observe that we can curb the acidity level, but we can also curb the critical pH level at which tooth damage happens. Those with gum disease who have exposed roots or exposed dentin due to a lack of enamel are more susceptible to tooth damage, as the critical pH is 6.5, which is nearly neutral. You may feel sensitive as a result. To prevent future deterioration, a dentist must repair the tooth to cover those areas. Fortunately, we can further protect our teeth by lowering the critical pH. The most effective approach to do this is to add fluoride to our toothpaste, which will lower the critical pH from 5.5 to 4.5. This is crucial because it will shorten the period that the teeth are below the critical pH where damage occurs. Keep in mind that the pH might drop far below 4.5 depending on your diet, which is why you're not immune to cavities. A dentist may recommend fluoridated prescription strength toothpaste, which has around 4 times the amount of fluoride as ordinary toothpaste, to people who are at a higher risk of developing cavities. Hydroxyapatite toothpaste is an alternative to fluoride toothpaste. Although the hydroxyl group binding to calcium is far weaker than the bond between fluoride and calcium. This is due to fluoride being the most electronegative atom, which means that its binding with enamel is stronger than that of the other elements and requires more energy to break it by bacterial waste. Because of this, the critical pH is lower for high fluoride individuals compared to hydroxyapatite, which makes them more protected against acidic environment. Let's examine the effect of eating on an average person over the course of the day. After awakening and eating breakfast, we can observe a decline in the red zone and recovery. Then another decline and recovery after eating lunch, another one after a snack a bit later, and more after sugary drink. After that, there are downward spikes and recovery for a long dinner, a drink, and then dessert. A cheese snack later in the evening. You can observe that there are spikes and recovery following each meal, and the length and intensity of these phases vary depending on how long and what we consume. Interestingly, eating cheese prevents an acidic spike below the critical pH because cheese is cholestatic, which means it is beneficial to your health of your teeth because it works as an acid buffer and stimulates saliva, both of which are beneficial for restoring enamel. Eating cheese makes it advantageous. Recall that our pH level drops below the critical pH level after eating, drinking, or vomiting. Therefore, you should stay away from brushing for at least half an hour to prevent tooth abrasion of your enamel. We will now review the lessons we learned through my eating habits and dental hygiene. Recognize that this is an ideal scenario, and even I break these habits when traveling or treating myself. But having consistent habits is the goal to achieve to reduce the risk of dental cavities. If you have been taking regular care of your teeth, a few days a year won't make a difference. In the end, this is to demonstrate what you can do to increase your chances of avoiding dental cavities. As you can see, because I use fluoride toothpaste, my critical pH is around 4.5. I skip breakfast and use fluoridated toothpaste to brush my teeth when I get up. After eating lunch, I usually floss to get rid of food that has gotten between my teeth. rinse my mouth with water, and then chew xylitol gum. I would stay hydrated throughout the day by drinking water. For me, dinner is the largest meal of the day, where I have meal with cheese and sugary drink, followed by dessert and fruit. I finish this in less than an hour, then floss, drink water, and chew xylitol gum. My water intake and use prescription strength fluoridated toothpaste before bed. As you can see, I'm far less likely to harm my teeth using this technique because I'm typically above the critical pH level. I had a lot of work done in my adolescence due to cavities because I was not taught how to take care of my teeth or see a dentist. I haven't experienced any dental problems in a long time since. Rather, I strengthened my teeth to make my smile better and had implant placed to restore my best eating experience. What can you do to be 1% better today than you were yesterday? Start flossing after meals. You will like the feeling of not having a piece of food stuck between your teeth. Drink more water rather than sugary drinks. I like to consume sparkling water. Chewing xylitol gum to increase saliva and freshen your breath. Include cheese in your diet, it's also delicious. For optimal plaque removal and protection, use an electric toothbrush with fluoridated toothpaste. And make sure an appointment for your dental checkups before issues arise. Once you get to know us, we are not that scary. However, if you avoid visiting a dentist until pain arises, which is usually involves numerous procedures because other teeth are probably impacted as well, it becomes scary. As long as you take care of your teeth, you can treat yourself by eating the food that you love. Furthermore, if anyone who claims fluoride is bad for you is uneducated about the principles of nature, which includes physics and biochemistry, there is no substantial evidence out there that suggests an alternative to fluoride is better. Because once again, the bond between calcium and fluoride is the strongest and hardest for acid to break. I sincerely hope that this comprehensive video will change your perspective on dental cavities and what you can incorporate into your daily habits so that you can preserve your teeth for the rest of your life and stay happy with your smile. Remember, our goal is to assist in you maintaining and improving your teeth as needed.